ahead and tell them what you just told me about your fluoride experience.
Well, since Wendy Briggs and since we did the fast start, our fluoride has went from 27% to 58% acceptance. And that's all because of you and your verbiage skills and accepting it and not being resistant to it. And we love you.
Hi, my name is Kim Encampo, and we just started the Whitening for Life program.
Hi, my name's Dr. Art Engelagi, and I've known Wendy Briggs about a year now.
Hi, I'm Dr. Rob Heron from Columbus, Kansas, small town in the southeast corner.
Hello, this is Dr. Eric Compton from Munster, Indiana.
Hi, I'm Robin from Dr. Brad Parker's office.
I'm Dr. Kevin Bond. I practice in Lake Mary, Florida, which is a suburb of Orlando.
Hi, my name is Dr. Stephanie Aldrich, and I'm a general dentist from Ohio, and I've been using Wendy Briggs's Hygiene Diamonds program for about a year. It's been about April of 2007.
And we use Wendy Briggs and her Whitening for Life program and her Diamond Hygiene program.
And it's amazing that I read all the information and I was a little skeptical that it would actually work, but it really does work.
And I noticed that doing the Whitening for Life program, we've brought in over 700 patients that have signed up for the program.
It works great. Wendy is a fabulous support person for the office. You have a question, she and her team are there to answer it for you.
Our production, we were doing an average of about $850 a day per hygienist, and now we're up to $1,200 a day per hygienist.
She's got awesome ideas. Really think that she's on the cutting edge and really is in touch with what the hygienists are going through and what they can do.
The Whitening for Life program is fabulous. It is so exciting for the patients to get the additional bleaching and to continually to bring them in and for their recall appointments.
And that ensures that we have 700 people every year that are coming back for their cleanings. Also, using other strategies that she teaches us in her seminars and during all of her products that she makes, we've also increased our hygiene production from around $700 a day to over $1,100 a day. So, and that's each hygienist. I do have 2 of them.
Just this week before we left Thursday, we signed up 3 new patients for Whitening for Life, and because we're more in a cosmopolitan high-end area, we decided to go a little bit higher than what Wendy recommends. And it's still working, and patients still love it because they're using it as part of their whole treatment.
She's been invaluable in training my hygienist. Some of the things that we've incorporated in our practice have been fluoride treatments for adults, Whitening for Life, which recruits patients for you every 6 months and keeps them coming back into your practice.
I took 2 brand new hygienists fresh out of school to Wendy's summer fast start type of program for hygienists, and they came back the very next month, and between 3 of the hygienists that have learned Wendy's techniques, they produced $58,000 the very next month in my practice.
That has been just a cash cow for us in our practice, and we've been very pleased with everything.
So I can't thank you enough, Wendy, and you guys got to do it.
I can't recommend it high enough to you. If you have hygienists that you want to get started quick, go see Wendy here in the summer.
For my practice, I think the biggest change we've had in the last year, as much as I am a marketer, it was not a marketing piece. It was how we fixed hygiene. Wendy goes through, hygiene's not a loss leader. My hygienist is my husband. That's a whole different story there. But, I knew it could be better, and we fixed hygiene. We got him on board. We got patients on board. We sold more dentistry. A lot of times, you look in dental practice management, they'll say, fill the doctor's schedule, there's opening before hygiene. And I honestly believe it's the opposite, because if I keep him full, I automatically am full. And he finds things, he sells things, patients trust him, he's a third-party endorsement, and his numbers went up, and it made the whole practice go up. So our biggest growth was in hygiene, and it just snowballed the rest of the practice. So I can't thank you enough, Wendy.
I was just like you. Last year's super conference is where I started my first event. And sitting in the audience, watching all the presenters present all their stuff, and I knew that we could take that information back to our office and run with it. We did. Office went great, everything but the hygiene department. Looking at my numbers, I was doing about $797. I've been doing that for years. I thought I was doing good. I didn't know I was doing anything wrong. I didn't get my aha moment until the client appreciation event that was held here in March. Again, offices were presenting their stuff. They were getting great responses from everything we were doing, and I was noticing my hygiene department was still flatlining. I was sick to my stomach. I wanted to crawl underneath the table. I just couldn't be seen. So at the next break, I went back and found Wendy Briggs. I asked her if she would help me. She said she would. I made a promise to her and to myself that she would be talking about me at this event on how well I did in the year. We took the information back to the office, and it was like someone turned the light switch on. I took my average from $797 to $1,200 a day. I was able to roll that even more to doing $2,000 days, and I rolled that to my biggest day ever of $2,617 in unassisted hygiene. I made a goal for myself to do a $3,000 day. I've been waiting and doing that, and I did that. I did that on Wednesday. I had my first $3,000 day of unassisted hygiene.
You can see here's my staff, and I wanted to throw out a couple things because Wendy brought a lot of stuff up in my mind with our hygiene stuff because I didn't put some of this stuff down into the PowerPoint. We had our first $2,000 day for our hygienist, Mary Ann, who's standing next to me on the right of me, and I was pretty happy with that. That was on Wednesday, and that was 4 weeks after her very first introduction with the whole Wendy Briggs phenomenon. So thank you, Wendy, for inspiring her. And I know that's just the tip of the iceberg. By the way, just tell her.
My name's James Drake. I'm from Idaho Falls, Idaho. It's a little town of about 50,000 people with about 65 dentists in it. And we started with Wendy, and she finished the little presentation that she gives, and within 1 hour, the following day's hygiene schedule was slam booked full. It had holes all over in it when she came that morning. And she had paid for herself within 1 week. Our hygienist has applied her principles but wasn't there for her first visit just finished this month at over $30,000 production.
Hi, this is Wendy Briggs. I'm president and CEO of Hygiene Diamonds, a national consulting firm. So my challenge is to give you enough ideas to increase your hygiene by at least $700 a day. And they watch the numbers, and they usually react, again, before I have to say anything at all. You can actually pick up the Dagnodent, dust it off, and use it. Look for opportunities that you would do in your own mouth. Our vision is that we're treating the patient, not their insurance policy. So we need to change our own mindset.
We had them all trained up, and then lo and behold, the whole daggone department quit. So I'm starting over with a brand new hygienist. We put her through Wendy's staff program and a box program, and inside of a week, I've got a brand new hygienist just out of school, and she's averaging between $1,500 and $2,000 a day, with assisting bumping up to about $2,500 a day. So this program is possible, and it works very, very well with any brand new even hygienist. So thank you, Wendy, and I appreciate it very, very much.
We brought Wendy in to do training, Whitening for Life, bonus hygiene production. She's just incredible. Hygiene Diamonds, I can't say enough about it. Incredible investment, but the reward and the return on the investment so far has been astounding. She's worth her weight in gold.
Best day ever in hygiene this year, 2,321. Go hygiene. This is one person, one hygienist. And that's from using Wendy Briggs' technique. Best month in hygiene was last month, $26,000. Typical month last year was about $11,000, $12,000.
Hi, my name is Rand Hunter from Michigan, Metro Detroit area. We recently purchased Wendy's cash cow system and implemented that. Two hygienists. One of them embraced the concept immediately. The other one, not so much, and we're currently looking for another hygienist. But the one that did has just had exponential growth. She's had one day that was over $3,000. She's routinely hits $1,500 to $2,000, $2,500 in assisted has been working very well for us. So thank you, Wendy.
If you think Wendy is like a Barbie doll blonde, I think of her more as a Tasmanian devil. She is amazing, and the ladies are drawn to her like a magnet, and they latch onto her principles and take off. So you need Wendy.
He said,